Vaccine therapy has been thought of for many years for hematologic malignancies, and the theory behind that is, can you train the immune system to do what it was supposed to do, which is fend off all of these horrible tumor cells. So most recently, we are hopefully going to see the results of the BMT CTN 1401 dendritic cell vaccine platform. Now, this is a trial where patients' own myeloma cells were fused to their dendritic cells in order to allow for antigen presentation and cross-presentation to the patient's own immune system. And it was a very interesting and initially complicated, but ultimately simple idea that allowed for different centers to be able to produce their own vaccine for their own patients. So it's personalized vaccine therapy. And the idea of fusing these two types of cells is actually a very simple one. And these vaccines were administered in the context of immune reconstitution after transplant with lenalidomide and GM-CSF. So the arms of the study are the control arms, which incorporates just len maintenance and len and GM-CSF, versus the experimental arm, which is lenalidomide maintenance therapy, GM-CSF, as well as these 3 vaccine doses. So we look forward to seeing the outcomes of these trials. I think that the interesting thing about this trial is not just going to be the primary outcome, which is complete response at 1 year, but really what happens with the immune correlatives. Can we get patients to have a stronger immune response to their own myeloma if they're vaccinated during immune reconstitution? Because that's something that we want to be able to retrain the patient's own immune systems to do the best job that they can to keep this disease at bay for as long as possible.